So I used the Ascent survey in my course. It's PHPH 431 Contemporary Issues in Public Health. This is a topical seminar style course where we run through the gamut of public health topics, going through one per week. And it's heavily team-based. So students are working in teams consistently, either working on case analyses, responding to a scenario, or developing presentations about the topic of the week. Using the Ascent survey in contemporary issues, I found lots of different things. The first time I used it was in spring of 2025, looking at all the different learning conditions, and the learning condition that we found seemed to be most impacted was belonging certainty. And so spring of 2025 was kind of an interesting time socially, politically, for public health, for individuals in higher education. And so belonging certainty was the one that seemed to have scored the lowest, and it was the one that I focused on as, kind of part of the cycle. When you look at belonging certainty over the course of the semester, you can see that among the three surveys, it did increase over time. But when you disaggregate the data and look at those students who are resource secure or resource insecure, you can start to see that the intervention that was selected will, impact these two groups a little differently. And so making sure that you are meeting students where they are, regardless of what they're bringing into the classroom, and identifying some of these population characteristics is one of the things that I appreciate most about the Ascend survey. And it's results like this that I think are very telling. So once I identified that belonging certainty was that learning condition that had scored pretty low, I went through the practice library and identified a couple different options. But the one I ended up selecting was the belonging story. And as my public health major and minor students were trying to, understand their place, their selected major, etc., I shared the story of how I came to public health and kind of that moment when I realized that public health was a passion of mine. And so one class period, I just selected this opportunity to share that story. Took about 20 or so minutes, and then facilitated some dialogue, answered some questions after that. But the belonging story was the thing I selected. What stood out to me using the belonging story as this intervention was that it did in the moment seem to be well received. That opportunity to share something about myself to students seemed to resonate well with them. And then as the semester progressed and we did the Ascend survey the second and third time, seeing that improvement in belonging certainty was the thing that kind of helped me realize that I was doing well, and creating an environment in which students felt more comfortable and certainly felt more certain about where they were. Another thing that stood out to me from the students' responses, and something else that I feel kind of proud of, was identifying that there were aspects of the course, the team-based learning with a heavy peer evaluation component. And the Ascend survey helped me think about how that component of the course was resonating with students. I certainly hadn't felt like doing regular peer evaluation and holding individuals accountable for their contributions was controversial, but I did identify that students indicated that Identity safety was something else that was being scored low and actually didn't improve and or got worse as the semester progressed. And so I guess one thing that I feel proud of that I'm still thinking about is just how I've constructed my course and some of these best practices that I feel like I've established and incorporated into the course might be perceived differently by the students.